Remember, this video is for informational purposes only and does not constitute medical advice. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment. Hey everyone, and welcome back to the channel. I'm so glad you're here today because we're diving into something that affects thousands of people worldwide, yet often flies under the radar. Myositis. You know that feeling when climbing a single flight of stairs leaves you completely winded? Or when lifting a gallon of milk feels like you're trying to hoist a bowling ball? Maybe brushing your hair has become a genuine struggle, or getting up from the couch feels like an Olympic event. If you're nodding right now, you might be thinking, I'm just out of shape, or that's just aging, right? But what if I told you these could be signs of something more specific, something that deserves attention and understanding? For those of you living with these mysterious symptoms, I see you. The frustration of feeling like your body is betraying you. The confusion when doctors can't immediately pinpoint what's wrong. The isolation of dealing with something most people have never even heard of. And for those who have a loved one struggling with unexplained weakness and fatigue, I know you're searching for answers too. You want to understand what they're going through and how you can help. Today, we're pulling back the curtain on myositis, a group of rare autoimmune conditions that cause muscle inflammation and weakness. But this isn't just going to be a clinical explanation. We're going beyond the medical textbook definition. We'll explore what myositis actually feels like day to day. We'll break down the different types, the often frustrating journey to diagnosis, and the latest treatment approaches that bring hope. I'll share real stories from the myositis community and practical strategies that make a difference. Whether you're newly diagnosed, a longtime warrior, a concerned family member, or just someone who wants to understand more about autoimmune conditions, this video is for you. Knowledge is power, especially when it comes to rare diseases. Before we dive in, I want to be clear that this video is for informational purposes only and doesn't replace medical advice. Always consult with healthcare professionals about your specific situation. All right, let's start at the beginning. What exactly is myositis and why does it happen? Let's break it down. All right, let's start with the basics. The word myositis might sound intimidating, but if we break it down, it becomes much clearer. Myo refers to muscle, and itis means inflammation. So at its core, myositis is simply inflammation of the muscles. But here's where it gets interesting. This isn't just regular inflammation like when you sprain your ankle and it swells up. In most forms of myositis, something goes haywire with your immune system. Think of your immune system as your body's security team. Normally, these security guards are excellent at identifying threats like viruses and bacteria, and they spring into action to protect you. But in autoimmune conditions like myositis, these security guards get confused. They start mistaking your own healthy muscle tissue for invaders and begin attacking it. This friendly fire from your own immune system causes inflammation in your muscles, which leads to weakness and sometimes pain. And because your muscles are literally everywhere in your body, helping you move, breathe, swallow, even keep your heart beating, this inflammation can affect many different aspects of your health. Now, it's super important to understand that myositis isn't just one single condition. It's more like a family of related disorders. Each type affects different muscle groups, can involve different parts of the body beyond just muscles, and might require different treatment approaches. The common thread running through all types of myositis is muscle weakness. But, and this is crucial, it's not the kind of weakness you feel after a tough workout. It's persistent. It doesn't go away with rest, and it often follows specific patterns that doctors can recognize. Many people with myositis also experience profound fatigue. And when I say fatigue, I don't mean being tired after a long day. I'm talking about a bone-deep exhaustion that can make even the simplest tasks feel overwhelming. As one patient described it to me, it's like trying to function with a phone battery that's permanently stuck at 10%. Now that we understand the basic concept, let's explore the different members of the myositis family. Because knowing which specific type you're dealing with makes all the difference in treatment and management. Just like how no two people are exactly alike, myositis shows up differently depending on which type you have. Let's break down the main players in the myositis family. First up is polymyositis, or PM for short. Poly means many, so this type affects many muscles, typically the ones closest to the center of your body, your shoulders, upper arms, hips, and thighs. These are what doctors call your proximal muscles. If you have polymyositis, you might notice things like struggling to reach up to a high shelf, having trouble getting up from a low chair, or finding it difficult to climb stairs without using the handrail. The weakness usually develops gradually over weeks or months, and it tends to affect both sides of your body pretty equally. Next, we have dermatomyositis, or DM. This type shares the muscle weakness pattern of polymyositis, but with an added twist. It also affects your skin. The skin manifestations in dermatomyositis are actually quite distinctive. You might develop what doctors call a heliotrope rash, a purplish discoloration around your eyes, almost like eyeshadow, or Gautron's papules, raised reddish or purplish bumps over your knuckles, elbows, or knees. An important note about dermatomyositis in adults. It can sometimes be associated with an underlying cancer. This doesn't mean everyone with DM has cancer, not at all, but it does mean that cancer screening is an important part of the workup if you're diagnosed with DM as an adult. The third major type is inclusion body myositis, or IBM. This one's a bit different from the others. IBM typically affects older adults, usually over 50, and it progresses more slowly. What makes IBM stand out is which muscles it affects, while PM and DM mainly target those proximal muscles close to your trunk. IBM also affects distal muscles, those in your forearms, hands, and lower legs. This can lead to very specific problems like difficulty gripping things. Think trouble buttoning shirts or using keys, or weakness in the front of your thighs that can cause your knees to buckle unexpectedly. Another common issue with IBM is difficulty swallowing, which can be quite serious. Unfortunately, IBM doesn't respond well to the standard treatments that help other forms of myositis. Research is ongoing to find better approaches for this challenging type. Fourth on our list is necrotizing autoimmune myopathy, sometimes called NAM or IMNM. NAM can be particularly aggressive. The weakness often comes on more rapidly and severely than in other types. What makes NAM distinct is that it causes significant muscle fiber death. That's what necrotizing refers to. Blood tests typically show extremely high levels of an enzyme called creatine kinase, which leaks out of damaged muscle. Interestingly, NAM can sometimes be triggered by statin medications, those commonly prescribed cholesterol-lowering drugs. And in some cases, the muscle problems can persist even after stopping the medication. Last but certainly not least is juvenile myositis, which affects children under 18. The most common form in children is juvenile dermatomyositis, or JDM. While it shares features with adult DM, children can experience some unique complications like calcium deposits under the skin or in the muscles, called calcinosis, which can be painful and difficult to treat. The good news is that with early diagnosis and treatment, many children with JDM respond well and can achieve remission. So there you have it, the main types of myositis. Remember, getting the specific diagnosis right is crucial because it guides treatment decisions and helps predict what challenges you might face. Now that we know the players, let's talk about what might be causing all this in the first place. So what exactly causes myositis? This is often the million-dollar question that patients ask, and I wish I could give you a simple, straightforward answer. But the truth is, for most types of myositis, we don't have the complete picture yet. What we do know is that most forms of myositis are autoimmune in nature, meaning your immune system is mistakenly attacking your own tissues. But why does this happen? It seems to be a perfect storm of several factors coming together. First, there's genetic predisposition. Certain genetic markers appear to make some people more susceptible to developing autoimmune diseases, including myositis. This doesn't mean you'll definitely get myositis if you have these genes. It just means your risk might be slightly higher. Then there are environmental triggers. Think of it like this. Your genes load the gun, but environmental factors pull the trigger. These triggers might include viral or bacterial infections. Your immune system gears up to fight the infection, but somehow gets confused and starts attacking muscle tissue too. Certain medications, we mentioned statins earlier with NOM, but other drugs have occasionally been linked to myositis-like symptoms as well. UV radiation, especially for dermatomyositis, sun exposure can trigger or worsen skin rashes and potentially flare up the systemic disease. For dermatomyositis in adults, there's another important potential trigger we need to discuss: underlying cancer. In some cases, particularly in adults over 50, the immune system might initially be responding to cancer cells, but then mistakenly attacks muscle and skin tissues that share some similar proteins. For inclusion body myositis, the picture gets even more complex. While inflammation is definitely present, there are also signs of degeneration, similar to what we see in conditions like Alzheimer's disease. Abnormal protein clumps form inside muscle cells, contributing to their dysfunction. Think of it like this. Most autoimmune conditions are like a case of mistaken identity. Your immune system is trying to do its job, protecting you from threats. But it's working with faulty information, like a security guard who received the wrong description of a suspect. I know it can be frustrating not having a clear-cut cause to point to. Many people with myositis never find out exactly what triggered their condition, but understanding these potential factors helps researchers develop better treatments and, hopefully someday, prevention strategies. Now, let's talk about how to recognize the signs of myositis, because early detection can make a huge difference. Let's get practical and talk about what myositis actually feels like. What are the signs that might make you or your doctor suspect myositis? The cardinal symptom, the big one that defines myositis, is muscle weakness. But this isn't your everyday, "I'm tired" kind of weakness. It has some specific patterns that set it apart. In polymyositis and dermatomyositis, the weakness typically affects what doctors call proximal muscles, those closer to the center of your body. This translates to real-world difficulties like struggling to get up from a low chair or sofa without using your arms to push up, finding it hard to climb stairs without pulling on the handrail, having trouble lifting your arms to wash or brush your hair, difficulty lifting your head off the pillow when lying down. The weakness usually affects both sides of your body fairly equally and tends to develop gradually over weeks or months. You might not even notice it at first, but then one day you realize you're avoiding certain activities or finding workarounds without even thinking about it. For those with inclusion body myositis, the weakness pattern is a bit different. It often affects both proximal and distal muscles, meaning not just your shoulders and hips, but also your forearms, hands, and lower legs. This can cause problems with grip strength, making it hard to turn keys, open jars, or button shirts. You might also experience your knees buckling unexpectedly or find yourself tripping more often. Beyond weakness, fatigue is another major symptom that can be absolutely overwhelming. This isn't just being tired after a busy day, it's a profound exhaustion that doesn't improve with rest. Many people with myositis describe it as feeling like they're constantly swimming through molasses or wearing a heavy weighted vest all day long. Muscle pain is another potential symptom, though interestingly, not everyone experiences it. Some people have significant muscle aches or tenderness, while others have mostly weakness without much pain. It varies from person to person. Some symptoms can be more concerning and need prompt attention. Difficulty swallowing, what doctors call dysphagia, can occur if the throat muscles become weak or inflamed. This isn't just uncomfortable, it can lead to choking or food going down the wrong way into your lungs. Shortness of breath is another red flag, especially if it's new or worsening. This could happen because the muscles involved in breathing are affected, or because of lung inflammation, a condition called interstitial lung disease that can accompany certain types of myositis. For dermatomyositis specifically, the skin manifestations are often the most visible signs. The classic heliotrope rash, that purplish discoloration around the eyes, and Gottron's papules over the knuckles and joints are hallmarks. Some people also develop redness in a V shape on the chest or across the upper back and shoulders. Less common but still important symptoms can include joint pain, voice changes, sensitivity to cold in your fingers and toes, Raynaud's phenomenon, and in some cases, heart problems. If you're experiencing persistent muscle weakness that you can't explain, especially if it follows these patterns, it's really important to talk to your doctor. These symptoms can overlap with many other conditions, but the specific patterns can help point towards a potential myositis diagnosis. Speaking of diagnosis, let's talk about that journey, which can sometimes be quite challenging. Getting diagnosed with myositis can feel like putting together a complex puzzle. Because it's rare and can mimic other conditions, many people go through months or even years of uncertainty before getting answers. If that's been your experience, I want you to know you're not alone, and it's not your fault. So how do doctors actually diagnose myositis? It typically involves several steps and tests, with each piece adding to the overall picture. It all starts with a conversation, your medical history. Your doctor will want to know exactly what symptoms you're experiencing, when they started, how they've progressed, and if anything makes them better or worse. They'll ask about medications, family history, and other health conditions. Then comes the physical exam, where they'll test your muscle strength in different muscle groups, looking for those specific patterns of weakness we talked about. They'll also check for any skin changes, especially if dermatomyositis is suspected. Blood tests are usually the next step. One important test measures levels of muscle enzymes like creatine kinase CK, which leak into the bloodstream when muscle fibers are damaged. High CK levels suggest muscle damage, though they don't specifically confirm myositis. Here's where things have gotten really interesting in recent years. Autoantibody testing. Researchers have discovered specific antibodies in the blood that are strongly associated with different types of myositis. These aren't just diagnostic markers, they can actually help predict which complications you might be at risk for and how you might respond to treatment. For example, if you test positive for anti-Jo1 antibodies, you might be more likely to develop lung involvement. If you have anti-TIF1 gamma antibodies and you're an adult with dermatomyositis, your doctor might be more vigilant about cancer screening. Beyond blood tests, your doctor might recommend an EMG, electromyography. This involves inserting a very fine needle electrode into various muscles to record their electrical activity. It sounds intimidating, but while there's some discomfort, it's usually well tolerated and provides valuable information about which muscles are affected and how severely. MRI is becoming increasingly important in myositis diagnosis. Unlike X-rays, MRI can actually visualize inflammation in muscles, helping doctors target the most affected areas and track how well treatment is working over time. The gold standard for diagnosis is still the muscle biopsy, taking a small sample of muscle tissue to examine under a microscope. This can show the characteristic inflammatory cells and muscle damage patterns specific to different types of myositis. It's a minor surgical procedure usually done with local anesthesia. I know all these tests can sound overwhelming. The diagnostic process can be lengthy and sometimes frustrating. You might feel like you're not being heard or that your symptoms are being dismissed, especially early on when weakness might be subtle. My advice? Keep advocating for yourself. Keep a symptom journal. Be specific about how your symptoms are affecting your daily activities. And if possible, seek out a specialist with experience in neuromuscular or rheumatological conditions. Typically, a rheumatologist or neurologist who specializes in these areas. Once you have a diagnosis, the next question is usually, what can we do about it? Let's talk about treatment approaches. Now, for the part many of you have been waiting for, what can be done about myositis? While there's currently no cure for most types, there's definitely hope. We have treatments that can reduce inflammation, improve strength, and enhance quality of life. Treatment for myositis is highly personalized. What works for one person might not work for another, and your treatment plan will depend on your specific type of myositis, how severe it is, which symptoms are most problematic for you, and your overall health. Let's talk about the main treatment approaches, starting with medications. Corticosteroids, like prednisone, are often the first line of defense, especially for polymyositis and dermatomyositis. Think of them as powerful anti-inflammatory agents that can quickly dial down the immune system's attack on your muscles. The good news is that steroids often work quickly and can significantly improve strength. The not-so-good news? they come with a long list of potential side effects, especially when used long-term. Weight gain, mood changes, bone thinning, increased risk of infections, high blood sugar, and more. Because of these side effects, doctors typically try to use the lowest effective dose for the shortest time possible. And this is where other medications come into play. Enter what doctors call steroid-sparing agents, other immunosuppressive drugs that help control the disease while allowing the steroid dose to be reduced. Common options include methotrexate, azathioprine, and mycophenolate mofetil. These medications take longer to work, often weeks to months, but they're crucial for long-term management. They also have potential side effects and require regular monitoring with blood tests. For some people, especially those with dermatomyositis or cases that don't respond well to standard treatments, intravenous immunoglobulin, IVIG, can be a game changer. This treatment involves infusing concentrated antibodies from healthy donors. It works by essentially resetting the immune system in complex ways. This is where the field gets really exciting. Biologic therapies. These are newer, more targeted treatments designed to block specific parts of the immune system involved in causing inflammation. Rituximab, for example, targets B cells, a type of immune cell that contributes to autoimmunity. It's increasingly used for myositis, especially in cases that don't respond to other therapies. Research is actively exploring other targeted therapies like JAK inhibitors and complement inhibitors. The goal is to find treatments that are more effective with fewer side effects by targeting just the problematic parts of the immune system. Now, I can't stress this next part enough. Medication is only one piece of the puzzle. Exercise and physical therapy are absolutely crucial in myositis management. In the past, people with myositis were often told to rest completely to avoid stressing inflamed muscles. We now know that's actually counterproductive. Appropriate exercise is vital to prevent muscle atrophy and maintain function. Working with a physical therapist who understands myositis is invaluable. They can design a personalized program that includes gentle stretching to maintain range of motion and prevent contractures, along with gradual strengthening exercises to rebuild muscle safely. Aerobic activities like walking, swimming, or stationary cycling can help combat fatigue, improve cardiovascular health, and boost your mood, all important for overall well-being when living with a chronic condition. The key is finding the right balance, avoiding overexertion that could cause muscle damage while staying active enough to prevent deconditioning. It's a delicate balance that often requires professional guidance. For those with inclusion body myositis, I want to address something specific. As I mentioned earlier, IBM doesn't typically respond well to standard immunosuppressive treatments. Management focuses more on physical and occupational therapy to maintain function and learn compensatory strategies. Assistive devices like canes, walkers, or specialized utensils is needed. Swallowing therapy for those experiencing dysphagia. Tailored exercise programs to maintain strength in less affected muscles. Research is actively investigating potential treatments targeting the unique pathology of IBM, so there's hope on the horizon. Beyond these core treatments, symptom management is important too. Addressing pain with appropriate medications or therapies, managing fatigue through energy conservation techniques, treating complications like lung involvement, and for adults with dermatomyositis, appropriate cancer screening. Remember, treatment is often a journey of adjustments and close monitoring. Having a healthcare team you trust, including specialists who understand myositis, is key to navigating this journey successfully. Now let's talk about something equally important but often overlooked, what it's actually like to live with myositis day to day. Beyond the medical treatments and doctor visits, myositis profoundly impacts daily life. It's not just about the physical symptoms. It's about navigating a world that wasn't built for chronic muscle weakness and fatigue. One of the biggest challenges many people with myositis face is the invisible nature of their condition. You don't look sick, so friends, family, or colleagues might not understand why you need to rest so much, why you can't keep up, or why some days are so much harder than others. Imagine having to constantly explain why you need the elevator for just one floor, or why you had to cancel plans at the last minute because your energy suddenly crashed. It can be exhausting having to justify your limitations over and over. Daily tasks that most people take for granted can become genuine challenges. Simple things like opening jars, buttoning shirts, or even washing your hair might require creative adaptations. You learn to adapt, breaking down tasks into smaller steps, using assistive devices like jar openers, long-handled sponges, or grab bars, modifying your home or workspace, and carefully planning activities around your energy levels. Work life often needs adjustments too. You might need to discuss accommodations with your employer, reduce hours, or even change careers depending on the physical demands of your job. This can be emotionally and financially challenging. The mental health impact shouldn't be underestimated either. Living with chronic uncertainty, pain, fatigue, and physical limitations takes a toll. Feelings of grief for your former abilities, anxiety about the future, or depression are common and completely valid. This is where finding your community becomes so important. Connecting with others who truly understand what you're going through, whether through in-person support groups, online forums, or organizations like the Myositis Association, can be incredibly validating and empowering. People living with myositis develop remarkable resilience and problem-solving skills. You become an expert on your own body, learn to advocate for your needs with healthcare providers and in daily life, and find creative ways to continue doing what matters most to you, even if it looks different than before. It's a journey of constant adaptation and learning, but it's also one where many find unexpected strength and meaningful connections. As one person with myositis told me, it's taught me to focus on what I can do, not what I can't, and to appreciate the good days even more. We've covered a lot of ground today in our journey through the world of myositis. From understanding what it is, a group of rare autoimmune conditions causing muscle inflammation and weakness, to exploring the different types, the diagnostic process, treatment options, and what daily life looks like for those affected. We've learned that myositis isn't just one condition but a family of related disorders, each with its own characteristics. We've talked about how the immune system, which normally protects us, mistakenly attacks healthy muscle tissue, leading to weakness, fatigue, and sometimes pain. We've explored the often challenging path to diagnosis, the various treatment approaches from medications to physical therapy, and the importance of finding the right support system. If you're living with myositis, I want you to know that your experiences are valid. Your strength is remarkable, and you are not alone on this journey. The myositis community is small but mighty, filled with resilient individuals navigating similar challenges. If you're experiencing persistent, unexplained muscle weakness, especially following the patterns we discussed, difficulty rising from chairs, climbing stairs, or lifting your arms, please talk to your doctor. Early diagnosis and treatment can make a significant difference in managing myositis and preventing complications. And for everyone watching, whether myositis affects you directly or not, I hope this video has increased your understanding and empathy for those living with rare autoimmune conditions. Sometimes the most challenging battles are the ones that aren't visible from the outside. If you found this information helpful, please give this video a thumbs up. It really helps others find this content who might need it. Consider subscribing to the channel for more videos on health topics explained in a way that actually makes sense. I'd love to hear from you in the comments. If you have myositis or know someone who does, what has your experience been like? What strategies have helped you? Your insights might be exactly what someone else needs to hear right now. Remember, while myositis presents significant challenges, there's also hope in advancing research, in supportive communities, and in the remarkable resilience of the human spirit. Knowledge is power, and my hope is that this video has empowered you with a better understanding of myositis, beyond just the weakness. Thank you so much for watching. Take care of yourselves and each other, and I'll see you in the next video.